at your arm.
Yeah.
Can you touch it with your other hand? Have you ever done that before?
No, I haven't. That's fucking awesome.
Right. That is amazing.
It is.
Holy. I'm a physical medicine and rehab specialist here in Victoria, which means I'm a physician that really specializes in the functions of the body. So medicine was a late choice for me. Most people know about me. My first career was in the arts. I was a dancer. I trained through Canada's National Ballet School from the age of 10 to 18, and I had a very fulfilling dance career with the National Ballet of Canada. One day, I was in Toronto on the way to a theatre rehearsal, and I had an unexpected injury. I had a little 10-speed bike, and I just went over the bike. I went to the orthopedic clinic the next day, and he said, you know, you got to be in a sling for 6 weeks. You can't do anything, and meanwhile my arm won't move. It feels paralyzed. A friend suggested I read Oliver Sacks' book called A Leg to Stand On. He wrote a whole book about how the brain shuts down when you have an injury and how you have to reprogram it. And it was through his book I really started to understand why people get injured, how to get better, and it really made me fall in love with this concept. And I rehabbed, and then 6 weeks later I was performing at the Kennedy Center. That really hit for me, that there was a way that we could control our bodies on top of the injury. Your recovery pattern is going to really rely on the support system you had. And it was really at that moment that I realized that I had fulfilled my goals for myself and expectations and dreams, and that I probably needed to explore that part of my life that I was suppressing. I finished my dance career about 6 years later. I get home and there's a message on my machine. And it was a phone call from the Marie Antoinette Theatre at the Palace of Versailles, from Opera Atelier. And they said, "Hi Paul, we understand that you are now not with the National Ballet. We really need a dancer. Could you come work in 2 weeks? Don't worry, we'll work around your school schedule." So that took me full circle, and I worked in Baroque opera during my undergraduate at U of T, performing in Baroque theatres in Toronto. So I always say, when Versailles calls, you go. Flash forward 2017. My really good friend and co-collaborator, Rajiv Ribai, told me about this great spasticity conference, first of its kind that would be happening in Versailles. And I went there as a really good expert in spasticity, knowing how to manage it, know how to treat it. As the 2 days went on, I was actually getting really distressed in how advanced they were. They're offering their patients things that I've never dreamed of. And I just, I looked around, I started to tremble, and I said, you know what, I gotta do this. Like, I'm gonna go home. I have no money, no team, no funding, but I'm going to introduce this European technique that I learned in Versailles.
After my stroke, I did have spasticity, and it was bad. And it was painful. Having the spasticity is frustrating because you can't stop your own limbs doing it. It automatically does it.
Spasticity for me limited my movement. I, couldn't reach my head. I mean, it was very hard to walk. It made my movement very difficult.
Life before my brain injury was fun. I liked to do soccer, and I liked to do gymnastics. After my brain injury, I had like a huge, this big of a scar. So yeah. This big.
Spasticity will occur any part of the central nervous system, which is the brain stem, and into the spinal cord. If you gripped your arms as hard as you could till you'd hurt, till your fingernails were in here, and you pull as hard as you can, and then in slow motion try to reach out forward to grab something, but resisting as hard as you possibly can, that's what spasticity it is. It is a co-contraction of muscles. You can't relax what you want to relax, and you can't use what you want to use. What I learned in France was they had an incredible surgical neurectomy program. Surgeons would use microsurgery to dissect nerves to the spastic muscles. First, they did a diagnostic lidocaine block to the nerve they wanted and paralyzed it with an anesthetic. It was great, but we found the procedure a little bit cumbersome and slow as you kind of had to search blindly with a stimulator. And I thought, we could probably do this with ultrasound faster. We actually returned to Canada and started a neurectomy program with Dr. Emily Krause, and she was doing neurectomies very well. My goal was to work with Dr. Daniel Vincent to create efficient, fast diagnostic nerve blocks all over the body and turn this temporary procedure into something long-lasting, months to years.
Dr. Winston knew that I had been providing diagnostic and therapeutic nerve blocks using fluoroscopy and ultrasound for chronic pain management.
And I said, Dan, you're an ultrasound expert in nerves. I'm an ultrasound in muscles. Could you teach me? 2 weeks later, we are in Dan's office and we were doing ultrasound-guided nerve blocks. Because there's no literature describing the targets, we had to discover our own targets. So over the course of patients of several years, we started to map out each area.
A review of the available published research showed that diagnostic nerve blocks were able to temporarily relieve muscle spasticity. We started with the treatment protocol in terms of determining which patients were appropriate for cryoneurolysis. This depended on the response of patients to the diagnostic local anesthetic nerve block. If there was a relaxation of the affected muscle group, then there was a high probability that they would benefit from cryoneurolysis.
You're going to inject a local anesthetic. We see a response or we don't see a response. The fact that Dr. Winston would start off before doing the cryoneurolysis with doing a nerve block with a short-acting local anesthetic, these were all very reassuring facts.
This is a technique used in pain fields for decades, and this is very interesting to have the idea to develop a specific technique to treat the motor nerve. So treatment of the motor nerve with only a percutaneous treatment with just a local anesthesia, it was amazing.
Pennies of lidocaine. That is more powerful than the most potent neurotoxin that we have on a temporary basis. So a $4 billion molecule that we inject for our wrinkles, our body, which works really well. This is so immediate, it works faster and stronger. It just doesn't last. Like it's not an option for long term. So we went back to the patients that we treated and said, did you like it? And they said, well, yeah, it was amazing how much my elbow opened up. It was Dan who suggested, Paul, this is so beautiful, the results. Why don't we do cryoneurolysis? And Dan has been doing that as a pain specialist. There's only a couple of machines in Canada that have the capacity. And he said, well, my machine, which was built in 1980 and has a motor button for stimulation. He goes, no, we can do this. And the patient came back to me, I think 9 or 10 days later, and my heart just leapt because he was 2 years after a stroke. He had a really stiff arm that he couldn't move and his arm just thumped open. And not only that, he was always in this position, he was able to move that arm. And his arm over the coming weeks became so strong. He lifted up his grandkids, he told me. He was mowing the lawn. And then we did a second patient, and then more and more. And because there's no literature describing the targets, we had to discover our own targets. Week in, week out, we practiced ultrasound-guided blocks. And we were getting better and better, and then Dan would go back and do the cryo. The patients kept saying, this is so amazing. Can you do my shoulder? Can you do this? Can you do that? So over the course of patients of several years, we started to map out each area. And we realized everyone was interested, but how do you do it? How does it work? So that's when the idea of our textbook came out. And March 2020, I was in Orlando with a group of international doctors, and I said, would you join me in creating a book on advanced practice in spasticity based on the block? Dr. Eve Boissonneau arrived from Montreal to do her fellowship with me. Together, we spent the year mapping out all these parts of the body that had never been described for neurectomy or cryoneurolysis. We had to figure out where to position the body and which nerves to target. We hired Fraser McRae, a co-op student from UVic, who's now doing his master's and PhD in physiotherapy at Western University on what happens in the brain when you do cryoneurolysis. Eve just happens to be a dancer like myself, and we decided to celebrate every single new protocol that freed a patient's movements by doing a choreography. And it really became this amazing sense of joy to dance around the empty corridors of the hospital and empty rooms when everyone was gone for the day. But it really allowed us to relax and celebrate what we were creating.
Dr. Winston had to put 2 needles one after another, and when the actual cryo was happening, it took like 45 seconds, yeah, and during that time was very, very painful.
Just say one very. How about very? Yeah.
And my arms were like good so far up. I could not do that before.
The world needs to hear about cryo. I'm a pediatric anesthesiologist. I see kids with spasticity, and now I'm looking at them like, oh my goodness, you just need cryo. You need cryo, and at a young age.
Okay.
And now do that on that side.
Oh, look at that.
What's different?
That moves.
What normally happens?
It doesn't.
In the summer of 2021, we had huge changes. Dr. Vincent closed his practice and we had no more access to the machine. Thankfully, a company from the United States was opening in Canada and they agreed to sponsor us. So just as he closed his practice, this incredible handheld machine came. Instead of having a big oxygen tank-like structure, which was actually carbon dioxide, which powered it, it was a tiny little machine that has a little gas cartridge. The gas is what you'd use to make whipped cream, to pump up your bike tire, and many devices that we have commonly. So that was the generation 1. We could go up to the ward, we could go to a nursing home, anywhere the patient was, we could take it. It was so portable, and it's designed for the clinic. It doesn't need a special suite. So that literally changed our practice. We put in our gas canister, we close it, and then it prepares for the cycle. The way that cryoneurolysis works is we are going to take this and insert it in the body. The gas is going to flow into this tube. When it drops to minus 88 degrees, it will freeze everything around it. There's no drugs in this process. It's the water in your body that will create an ice ball. And each cycle lasts 106 seconds, so no drugs are going into the body. It's just so cold that the water is starting to freeze. What will happen is when this tip touches the nerve and drops to minus 88 degrees, it is so cold that the nerve will begin to disintegrate or degenerate. We call that Wallerian degeneration. What's really fascinating about physics is that at minus 88 degrees, only the neuron breaks down. We get loss of the axon through the myelin sheath and the axon inside it. No other structures are damaged. The blood vessels are not damaged. The tissues are not damaged. We know at this temperature nothing else will hurt. If we used a different gas, because this boils at minus 88 degrees, you would actually get tissue destruction. So you can see how big that ice ball is. It will cover a large segment. So basically, we are causing targeted destruction of that nerve, which will completely regenerate in about 6 to 9 months, but should have a longer lasting effect.
When I'm getting cryo done from Dr. Winston, it hurts like a son of a gun. Well, he sticks me, and then it hurts, and then it's like, it's gone. My life's changed because like my foot can flex a lot more, and my arm can stretch out a lot more. For anyone who feels the way that I do, it's gonna be okay.
After the cryo, I have not had any spasticity. It's been wonderful. I can actually now walk without falling over and without furniture surfing anymore. It's incredible how much it has improved my life.
I was very skeptical in the beginning of this treatment because it's been 12 years since my accident. How can he really do anything? And I told Dr. Winston when I came back for a follow-up, I was like, you know, you would have never seen me again if this hadn't worked. He's like, oh, I know. And so, yeah, I've come back to every follow-up every 3 months, taking the frickin' ferry from the, you know what I mean? So, yeah, I would go to China to see Dr. Winston. I really would.
So you lift your arm up overhead, it'll be sore.
Oh my God, okay, seriously, did you see that?
Do it again.
Shh. Am I the only one who's amazed here?
So, no, I'm happy.
Can you believe that, Jeff? Look at that, look, Jeff, look at this. This is my hand touching my right ear.
And you know, with respect to the therapy that Dr. Winston has done and continues to do, it just continues to increase her quality of life.
I want y'all to see something that I've been able to do for 12 years. Ta-da!
Now I don't have to do it and get yelled at because I do it terrible.
Suni has CP as a result of birth asphyxia, so just low oxygen at birth. It has been a journey of therapies and interventions. Fortunately, he's brain functions maybe a bit too well. So I keep saying that my job is to make sure his body keeps up with his brain. To that end, I have tried to explore every single possibility to just make life easier for him and give him as much independence as possible. Nothing beats being able to, do things for yourself if you can.
The really new and exciting portion for us here is this, targeting motor nerves, targeting spasticity, stiffness, rigidity, to improve range of motion and function. In terms of, long-term use, there's so many different applications. Even just the combination of increasing ultrasound comfort, which is, I find, a very challenging skill. The diagnostic nerve block, which is also a newer introduction, certainly for me, where I trained it. And then lastly, the cryoneurolysis. Those three components, I think, there is so much utility in using those, all those different tools in whatever combination. And it's very exciting to see how it is changing, really before my eyes, and how patients are literally much better afterwards. And it's immediate, and it's the immediacy, I think, which is the newest feeling from a practitioner. To see the results then and there, I think that's quite special.
Oh no, you're not going to go into your... I love this. We've had a whole day like this today. I know. We've already been through this today, so we're well prepared. We like tears of joy. When I started doing medicine, I realized it was about human relationships. And rehab is something physical and tangible. Every patient is putting their trust into me. Yes. I feel the reach. You did it yourself.
By myself.
Okay, do it again. Do it again.
I mean, is no one else amazed by what I did? I haven't done this for 12 years by myself.
Yeah. I stumbled upon the work of Lisa Boivin, and her work is so incredibly powerful on Indigenous informed consent, about how we really need to know the person that we're dealing with. I had to know who my patients were, give them the plan, give them the options, and ask them if they wanted to change, because not everyone wants to change. So our whole pattern is based on assessing a patient, getting their goals, getting their stories, doing nerve blocks to show them this is what you're going to look like when we're done. And in this, we do an intervention and it's immediate. We see what the pattern is, we change it until we get the perfect amount of change that we like, but more importantly, the patient likes. Seeing the patient in real time, getting feedback, it's just the most, it's almost a form of euphoria. I can't describe it any other way. Oh, beautiful. Wow. Okay, now I'm gonna cry. It's so beautiful, okay?
Thank you.
You're welcome. That was a lot to go through. Our journey is now, what can I keep adding to get that patient well, and not a population, the patient in front of me. It became this really emotional experience, like sometimes closing the door and like bursting into tears, or bursting into tears with the families, because someone would open their hand and touch their parent's face, or the spouse would grab their hand, or they'd get up and walk without their brace, or walk for the first time. And the results are immediate. When you do cryo, you get the result, and then it gets better over months. And suddenly in front of our eyes, people were unfolding. I really believe in the theory that medicine is movement and movement is medicine. Everything we do in physiatry is to keep your body moving. When I'm with my patients, I'm sitting at their level, squatting on the floor, watching them from every angle. I'm not just in front of the computer typing or looking at results. And I try to practice this in my own life as well. I know that is one of the things that not only brings me joy in my day, but it actually makes me feel human. So I will do everything in my power to help other people experience joy and freedom of their own in the world that surrounds them, just to even have one new position or movement of the body that lets them experience life a little bit more. Good. And lift to the side. And go like this. And way overhead. And down like crazy. Then the other side. Right to the side. Out like this. Straight out this way. Perfect. Okay, thank you. Thanks for coming down. Oh, more hugs. I'm really glad we did the second one.
What Dr. Winston, for persevering with this idea and just believing that it was possible, pushing through with, next to no funding and just making it happen, it's just incredible that people like Dr. Winston exist in this world. And I would happily fly halfway across the country.
We have no funding. There's no team. I needed to have people. And I found this huge group of medical students, university students, co-op students, my colleagues, everybody wanted to learn and help. And by doing under a teaching model, creating those teaching roles through UBC, UVic, having residents and medical students come across the country, they helped me. They are my co-authors, and they all entered that patient journey. During treatment days, we have many people in the room, many different types of physicians, surgeons, and therapists. We want to be able to maximize the patient care through diverse input of many people. We want to provide hands-on learning training for healthcare professionals from all over the world so that they can learn to use this technique with their patients. I do believe that knowledge is power, and the more our patients and caregivers know about what is being done to them, the more likely they are to feel empowered to continue to help themselves and to help others. It's really slowing down and listening to what the patient needs. They watch the ultrasound on TV, they see the procedure, we have a book that we wrote, we show them everything. We have stickers for the kids. I'm trying to make it more fun because the procedure is uncomfortable and at times very painful for people. So every step of the way I need them to trust that they can give me feedback, that they didn't like it, that they wanted it a different way, or it was too painful, or a lot of people say it was nothing.
After my accident, I was in a coma for 3 weeks. I was in the hospital for 4 months.
The doctors will say, but for the fact that she was in such great shape, she probably wouldn't have lived through her injury. It's been an inspiration to me, to our kids, to see how difficult, but just how strong she's been to fight to get better. And I mean, she's been an inspiration.
We have a set of outcome measures that nobody likes. And it's how much stiffness and resistance when you do a fast catch and a slow catch, or what the patient can move. And that's basically it. And you can look at maximum range, but it's one plane. And it absolutely is non-functional. It's not what happens when you're moving, when you're breathing. So all these studies that come from surgery, or especially the botulinum toxins, they don't really show change. As a movement person, it was the antithesis of what I do. I needed to know what was the change in life. Oh my gosh, and down. We see what the pattern is, we change it until we get the perfect amount of change that we like, but more importantly, the patient likes.
Wow. Our results have demonstrated that a substantial number of patients have benefited from cryoneurolysis.
We had to show that cryo was safe so other people could do it, and when we did have side effects, how we fixed it. We studied 113 patients who underwent cryoneurolysis involving a total of 277 nerves. Remarkably, 96.75% of 277 nerves reported no side effects following the procedure. When I started this journey, it was all through research, so every patient getting a treatment had to be within our research. I needed to be able to tell my patients and tell my international community, my university, that we understood what we were doing. We had to know everything, had evidence and experience.
So right now, after about 3.5 years, we have over like 250 cases. Most of them received cryoneurolysis for multiple muscles in different sessions. So we have a really big data set. The results so far are so promising, and we are really excited to share our results with the other physicians and also with the people who suffer from spasticity. Cryoneurolysis has been used for pain control since many years ago, but the use of cryoneurolysis for spasticity is a novel procedure.
Dr. Winston's research has had global impact. He is a pioneer not only of this therapy, but he's also a pioneer in, as a physician, integrating research as part of the care that he delivers to patients. Research is not separate from care. Research, when embedded into practice, creates a learning cycle so that every therapy given to patients becomes part of a learning program through research. There's always room for learning, especially where you have innovations.
So the innovation comes in, okay, well, what new muscle have we not blocked? What new muscle could we add? They now have a new pattern of tone. How do we do that? Can we do a brace? Can we use a TheraBand for strength? Working with my physiotherapists.
I've been involved with the studies that Dr. Winston has been doing for the last couple years. And my role is primarily treating the people who have received the cryoneurolysis. I'm also involved with measurement and some of our outcomes as well. So taking range of motion, videoing gait, and then I provide the treatment for these people after they have received the cryoneurolysis with Dr. Winston. After the treatment, they are able to start to gain some movement a lot faster than they may have with other forms of treatment.
We have lots of way to go. We need more funds to have more training sessions, to train other fellows and other physicians so they can offer this procedure to more patients.
We would not be able to do what we're doing without the Island Health Research Department, but even more importantly is the support of Victoria Hospitals Foundation. So that represents the people of the island and the region. So without their support, we have nothing. So it allows me to hire a team, have the technology to do what I need to do.
What we need to do, a couple things. We need to increase awareness. We need to finalize a lot of the research and data that Dr. Winston has done and publish it and have it peer-reviewed and disseminate it so that more and more people, like he's already doing and we're already doing now with visiting experts coming and trying and seeing, it just needs to be spread. And the dialogue will continue and it will be refined so that patients everywhere can benefit, that we don't have to take people from the States and from wherever else so that people can get it done locally, and that comfort with it can improve, and also that it as a concept in the medical world can be accepted. And then on the other side too is, practically speaking, as a treatment it's not covered for the patient, so we need to get that side done.
Well, I think the future is actually here for us now, because Dr. Winston has been very active with his colleagues in this area in creating a movement almost about this research, about the evidence to support it, and about the outcomes that are possible for patients that previously had the option of surgery or sometimes no option available to them. So the future, I think, is one of spread, which can be a challenge for innovations as well. But I think that Dr. Winston is well on the path to global adoption of a research-driven innovation that wouldn't be possible in this way without him.
I think the future is the development of this technique all around the world in many expert centers, and I think we have a multidisciplinary treatment, and we can work together, surgeon, physiatrist, physiotherapist, occupational therapist, for the best care for the patients. And I think percutaneous cryoneurolysis is the future of the care, and maybe a next gold standard in the field of neuroorthopedic treatment.
This is a game changer for the treatment of spasticity. Before this, it was either surgical options or temporarily paralyze the muscle, which is so limiting. This is so much more limitless of a treatment.
We are talking hundreds or thousands of patients' lives can be drastically improved by making this therapy, number one, known, and number two, available, so that practitioners across the world can bring the same benefits to their patients.
For me, it's hope that we're just in the infancy, that there's so much potential if we could do children before they develop their deformities and need surgery. So hope is the number one thing, but a really important thing has been acceptance. So when you come up with something new, you can be an outsider, you can be an outcast, people don't accept you. And because I'm such a transparent person, and that I've documented every step of the journey with videos, with presentations, sharing, teaching, people coming from all over the world, for me it's been a sense that it belongs and people want this to succeed. That people are coming from Harvard and Oxford and Michigan and Toronto and Calgary and Peru and Australia, and they all want to learn this technique to take it back to Italy and Switzerland. It's not just going to be my technique, that we have created this awareness. There's so many more things we can do. But the fact that we can now, with exquisite detail, figure out any motor pattern in the body and figure out if we can change it or not has been the most joyful discovery for me.